Hello and welcome to Midcoast Morning, CHOY's Current Affairs show. I'm Laura McKenzie. Last week, the Nanaimo Regional General Hospital saw the addition of the new Care and Connection Kiosk. The kiosk, provided by Vancouver Island Health Authority, will allow anyone to access free, life-saving harm reduction supplies. It will also provide information on mental health and substance use support services and treatments. Island Health states in a press release that the Care and Connection Kiosk will electronically dispense discretely packaged harm reduction items, including condoms, wound care supplies, naloxone kits, take-home drug testing strips, as well as syringes and safe disposal containers. This can be used as an alternative for people who currently visit emergency rooms for harm reduction and wound care supplies. As of the end of August this year, 84 people have died from the toxic drug supply in Nanaimo. This is an increase from last year where 77 people died. Harm reduction is one way to prevent the loss of more lives. Today we speak with Dr. Shannon Waters from Island Health, physician and medical health officer for the Cowichan Valley Regional District, as well as Nanaimo, Parksville, and Oceanside. We'll discuss the new kiosks and why Island Health has introduced them. Then we'll speak with registered nurse and professor at Vancouver Island University, Sarah Lovegrove, about her past in harm reduction. She speaks to the importance of allowing people to access proper harm reduction services and the efforts to end the stigma around use. Finally, we speak with Janelle Wilson, organizer at Vancouver Island University's Students' Union. The Student Union is hosting a free naloxone training for students at VIU this November 7th. With that, let's jump into it. Hello and welcome to Midcoast Morning. So to get us started, could you talk to me about the new Care and Connections kiosks?
Yeah, these are actually dispensing systems that are going to be placed outside of 3 hospitals, Nanaimo Regional General Hospital, Victoria General, and the North Island Hospital in Campbell River. And they're going to dispense harm reduction supplies. So these are things such as naloxone kits, syringes or wound care supplies, some sexual health supplies, things that people sometimes might go into the emergency department for. And with this kiosk outside near to the emergency department, it'll allow people some anonymity, a bit more ease of access, and also not affect services that need to take place in the emergency department.
And how were these items chosen?
So those would have been through staff working within the area and probably some peer engagement as well. So we have harm reduction staff, outreach workers, and people who have been working in the area of our response to the drug poisoning crisis for a number of years. And they know which supplies are being asked for in emergency departments or at our overdose prevention sites. Our overdose prevention sites are not open during all hours, and the emergency room is often a very busy and not easily accessible place that is dealing with other types of urgent issues as well. So knowing that these are supplies that people are looking for can take the burden off and increase the ease of people being able to access these things.
Mm-hmm. And you sort of kind of mentioned this, but why was this project started?
It was a collaboration between different areas of Island Health, and basically it was looking at ways as we move into many years into this drug poisoning crisis, how can we really try and help provide services and things to people that can help improve health and save lives. An aspect throughout the drug poisoning crisis has been people who have died at home alone, and often men in particular. We've been trying to find ways to work with men who are in the trades. As we all know, there's a lot of stigma around substance use, and that may at times keep people from accessing services. So this was seen as a way that has been looked at in other health authorities across BC, so in Northern and in Vancouver Coastal, and in 14 different countries around the world, to try and increase access and provide some life-saving modalities for people who might not necessarily be able to access at certain times or certain places because of, they're just not accessing service at all, making things more available to those groups.
Why are having these machines so important?
I think it's different and it's important because it's 24-hour day access. I will say that there are also staff who are going to be assigned to helping connect with people that they might see at certain times of day if they go by, or being able to access people who want to seek treatment. But it's really filling a gap in terms of 24-hour access without needing to go into the emergency room for things such as naloxone kits, syringes, or wound care. So things that help people stay well and can save lives. And it'll also be a way for people to access information about treatment and other mental health supports.
And for the staff members that will be supporting the kiosks, what do their roles look like?
So these would be people who would be like peers, someone who is approachable to people that might be coming to access things that are available in the kiosk, and they can be a liaison to getting either access to things such as wound care or detox or treatment or things of that nature. So basically a connector, a liaison.
A big conversation that goes along with harm reduction is about ending the stigma. In your opinion, what does it mean to end the stigma, and how can we do so?
Yeah, I think ending the stigma really looks at us all as human beings who have different challenges and struggles at different points of our lives and different ways we try to deal with them. So that not looking at the use of substances being something, different or worse or bad compared to other ways that people might deal with, traumas and different things that they're experiencing in their lives. So I think, looking at sources of treatment and care for substance use and the associated potential drug poisoning that we have now, providing many different ways to access care through these kiosks, I think is one way we can show our community members we're here and trying to make a way for these things to be available at all times. And everyone's a member of our community who has challenges and struggles at points in time.
And could we see more of these kiosks in the future?
I think it is a potential. We will be watching over the next number of months how they're utilized, what supplies are being taken most often, how the support workers in the area might be getting people referrals to other sources of treatment. So I think we'll be continuing to watch this as the months unfold. And if it's something that is being utilized well and is increasing positive outcomes, it certainly is something we would look at having in other locations on the island.
Shannon, thank you for joining me on Midcoast Morning.
Thanks a lot.
That was Dr. Shannon Waters, Physician and Medical Health Officer with Island Health. Now we are going to hear from Sarah Lovegrove, registered nurse and professor at Vancouver Island University, about the importance of safe and accessible harm reduction. We get her thoughts on the new kiosks. Hello, Sarah. Welcome to Midcoast Morning. To start us off, can you explain to me what your background in healthcare is?
I've been a nurse since 2016, and I was an emergency nurse at NRGH and CDH in Duncan. And I was also a part of the Nanaimo Community Action Team on the overdose crisis. Most recently, up till September, served as the chair of the Community Action Team.
And can you explain to me a bit about your work in harm reduction?
Well, harm reduction work comes hand in hand pretty naturally with nursing, but I've also been interested in harm reduction since before nursing, working with marginalized populations. When I lived in Ottawa, working with sex workers and people who have been trafficked. I've also been an advocate for people who use drugs in our community since about 2018, when I left the emergency department, working with people with lived experience in a drug user advocacy group operating a pop-up safe consumption site twice a week in Nanaimo until about May or June of 2019, and have been since continuing to advocate and work alongside people who use drugs in our community as they've been engaging in harm reduction and solutions to try to minimize death and harm related to the toxic drug crisis.
Mm-hmm. And you already sort of spoke about it, but for listeners who might not know, what is harm reduction and what are some examples of the items or resources used for it?
Well, harm reduction can be seen in multiple ways. I see it as primarily as sort of a way of being and a way to operate within the world, doing our best to find solutions and interventions that can reduce harm and injury related to any kind of risky behavior. And that can span anywhere from condoms and needles and naloxone kits to sunscreen and seatbelts and all those types of objects to keep people safe in everyday life. But in terms of harm reduction, specifically interventions related to drug use, it's essentially anything that can support people in safer choices and safer behavior in relationship to substance use, particularly in relationship to substance use that involves illicit substances. And as these substances have a tendency in our current times to be poison and unpredictable, and likely could cause injury and death when consumed. So it spans I would say harm reduction spans anywhere from safe consumption sites and safe spaces and safe services for people to access, to have discussions and learn more about substance use. Practically, we offer, I say we, but sort of the harm reduction community offers, safe tools and practices around consuming substances, whether that's through smoking or injecting, how to keep people safe from some of the implications of substance use. So right now, the supply of drugs is contaminated with something called xylazine, which promotes wounds and chronic wounds within people. So keeping people's wounds safe and clean in an environment that could potentially cause infection and more complications around that.
And to reiterate what you said, anyone can use harm reduction. It's not just for people using drugs or eliminating the risk of overdose. It can be someone using sunscreen so they don't get a sunburn.
Yeah, anyone who engages in everyday life can engage with harm reduction in any way. I would say, most people understand harm reduction tactics that have been fairly normalized. I mentioned earlier things like sunscreen and wearing seatbelts and all those different pieces in everyday life that we've learned to adapt into kind of how we engage with the world. And people who use substances specifically engage in harm reduction in a variety of ways, whether that's using with someone. That's a huge harm reduction narrative that's really being encouraged across the board right now, because it's the one thing that often keeps people alive within the context of a drug poisoning crisis is never using alone. And even people who drink alcohol, drink coffee, consume cannabis, smoke cigarettes, for example. There are harm reduction practices surrounding all of these activities, and people can engage with them at any point in their journey with substances.
Mm-hmm. And this might seem like a very obvious question, but in your personal opinion, in Nanaimo, is there a great need for free and accessible harm reduction supplies?
Yes. As the drug poisoning crisis continues to worsen and evolve, there needs to be steady, continuous access to harm reduction supplies for folks of all walks of life. And it's important that people have access to these pieces, because people, especially within the realm of using substances or having sex, people are going to engage in these behaviors no matter what. So keeping them safe and promoting education and understanding on how to be safer around these activities is really important.
Recently, Island Health placed a Care and Connection Kiosk in the Nanaimo Regional General Hospital. Did you hear about this new service? And if so, what are your thoughts on it?
I did, yeah. So the community action team was kept up to date with the evolution of this project being instituted over the last year or so. We work closely through the community action team, works closely with representatives from Island Health and harm reduction around that. So we got to hear the process of how this vending machine was going to be put into place, and we are huge advocates for it being installed.
Midcoast Morning is made possible by the Community Radio Fund of Canada's Radio Meters program and listeners like you. Support Midcoast Morning and CHOI's nonprofit newsroom today by becoming a sustaining donor at choi.ca/donate. Local news can't survive without your support. Another way to help us out is to share this show with your friends and tell them why they should support us. Finally, if you're listening to the podcast edition of Midcoast Morning, go and give us a positive review on Apple Podcasts or whatever podcast feed you use. It helps people find us.
Do you believe this will be a beneficial service? And will we hopefully see more in the future?
I do. I think this is a really great initiative in that for two reasons, one of which being the availability and accessibility of harm reduction supplies that are accessible to people 24 hours a day, 7 days a week in the emergency department. And this kiosk will serve people who are aware of it, but also people who are coming into the emergency department that may not know about harm reduction supplies and can access them through this. But in our community, we don't have any other services other than our hospital that offers 24/7 services around harm reduction. And drug use doesn't happen on a 9 to 5 basis, Monday to Friday. It happens 24 hours a day, 7 days a week. So allowing people the access and the privacy to go to a kiosk to get the materials and supplies and supports that they need is really groundbreaking. And in addition to providing that service to people who use drugs in our community, we're also relieving some of the burden and weight on our emergency department and our healthcare system, because we're in a healthcare crisis. And if anyone has accessed the emergency department in the last several months, it's quite clear. And the materials that are being offered in these kiosks are the most readily identified requests in it that come to the emergency department. So, for example, wound care supplies, people are often coming to the primary care outreach van or the emergency department for wound care supplies to help their friends or to help themselves. And the ability to access these services without having to interact with the healthcare system makes it more accessible for people, because oftentimes people are quite afraid of accessing healthcare services for these specific needs, as well as relieving the pressure on staff to provide these services when it's not necessarily something that people would need to access the emergency department for.
If Nanaimo was to get a second kiosk, where do you think would be another good location for it?
I would love to see one accessible downtown, perhaps outside. I would love to see a 24/7 safe consumption site going downtown. But in lieu of that, I would love to see a kiosk like this be put outside of the Albert Street Safe Consumption site run by CMHA. Right now, they have great services and offer harm reduction supplies within their space, but they are limited in their number of hours that they're open. So having that type of kiosk outside of that space would serve the people who need it most, I would say, if they're already used to going to that location.
Mm-hmm. And what are some other resources you feel like Nanaimo is lacking in to help support people with either their mental health or substance use?
Well, I would say there are huge gaps in social determinants of health and accessible services within our community. Although there are a huge number of organizations doing incredible work, these services are often funded only in part or for limited amounts of time, which leaves people who need to access these services kind of without them when those services no longer have funding. We obviously need accessible wraparound support services in accessible housing that doesn't limit people as per their relationship with substances. So people need to be able to be utilizing the substances that they need while accessing safe, supportive housing. And we need to have not such a reliance on downstream outreaches and harm reduction tactics that we rely on so heavily now, but more services that empower and provide support to people in getting to the state of health that they would prefer to be in.
And when talking about the overdose crisis and harm reduction, there's always talk about ending the stigma around it. In your opinion, what does that mean, and how can we end the stigma around it?
Well, in terms of this drug poisoning crisis that we're in, we often say that the number one killer in this crisis is stigma, because people are still readily stigmatized because of their relationship with substances, and substances themselves are stigmatized. So encouraging education, understanding, and compassion around this issue can really help people understand that people use substances for a variety of reasons, most notably to cope with life experiences, adverse childhood experiences, trauma, and all those pieces. So really expanding our capacity for compassion around this issue is important. when I mentioned before that one of the number one reasons people die when using substances related that are poisoned currently is because they use alone. And people are often driven to use alone as a result of stigma, especially people who don't have a circle around them of people who use drugs necessarily. So stigma often drives people into isolation, and that increases the risk of injury and death related to substance use. So I really think that people need to engage in these conversations more readily. The community action team, for example, is hosting a series of dialogues in early 2024 to try to engage with businesses and libraries and all kinds of organizations to reduce that stigma and just have these conversations and help people understand that most people in our community do use drugs, and whether they talk about it or not. So it's really a conversation that needs to be had to keep people alive and keep people safe.
And do you believe these kiosks will help normalize the conversation around drug use?
I do. I think that it's a great first step in having that conversation, even within the hospital itself. Not all staff and physicians and nurses, for example, are on board or understanding what harm reduction means. So this could facilitate conversations within those spaces around how important harm reduction as a practice and as an intervention is. And, I think there's a lot of previously misunderstood information out there about harm reduction and how it contributes to this ongoing crisis. And it's just really important to start having these conversations with people and facilitating these conversations between people, within families, at the dinner table, at schools, and sort of across the board, because there's just a lot more substance use and impacts of substance use happening in our community than people really realize.
And do you have any resources you recommend for people to learn more about what we talked about today?
Well, accessing any of the harm reduction services in our community can really be beneficial to anyone who's looking for support for themselves or for others. Going to the CMHA Safe Consumption site, talking to those folks about the services that are available, drug checking, safe consumption, and harm reduction supplies in general, talking to healthcare providers, seeking out support from people in our community who do education around harm reduction. AVI, for example, is a great clinic in our community that offers incredible harm reduction opportunities, safe supply, those types of pieces. And there's a lot of resources that have recently become available through Island Health about harm reduction as well, through an incredible team there. And so if people are looking for harm reduction education in the community, they should really just look to the leaders within our community. The community action team is also a great resource for folks if they're looking to connect with specific resources, because it's really a network of all the contributing players and organizations in our town who have anything to do with this toxic drug crisis. So they can always help you point you in the right direction for supports that are needed. And you can find them on Instagram or connect with the coordinators there.
Well, Sarah, thank you for joining me on Mid-Coast Morning.
Thank you so much for having me.
Training to administer naloxone is an important way to protect somebody from an overdose and can be life-saving. Now, Janelle Wilson, organizer at Vancouver Island University's Student Union, will talk to us about the free opportunities Vancouver Island University students have to take the training. So next week, the Student Union is hosting free naloxone training for VIU students. Why are you offering this training?
We do for a number of reasons. I think first and foremost, toxic drug supply in the region. There's a lot of people who have lost their lives in Nanaimo, on Vancouver Island, and in the province. Every year there's deaths that occur, but this year especially, it seems like there's been an increase in numbers. And so we kind of took that and are offering some training as somewhat of a response. It seems like a drop in the pool in what we can do, but at least it's something and something we can offer to students.
And how many students usually partake in these type of trainings?
So we offer it in a small kind of class size. The training is very hands-on, and it requires the the lead to be more hands-on with who's in the room. And so the capacity is set for about 15 to 20 students.
Who is doing the training, or what organization is taking part in the training?
Yeah, so we work with AIDS Vancouver Island, the Nanaimo division. And so the person that we have running the workshops, her name's Claire Deneen, and she's the AVI Health and Community Services Health Promotion Team Lead.
And why do you think it's so important for VIU students to learn how to administer naloxone?
Well, I think it's a crucial skill that, if you're in a position to need to know how to administer that and you don't have that skill, then you're ultimately putting yourself in a position where you're not able to help that person. And so I think it can be like a life-changing act of kindness for yourself, but also, of course, a life-changing moment for whoever's suffering and in need of that help.
Janelle, thank you for your time.
You too. Have a good one.
That was our story for the day. Thank you to Dr. Shannon Waters, Sarah Lovegrove, and Janelle Wilson for joining me today. For more information on preventing overdoses, you can go to stopoverdose.gov.bc.ca to learn more about how you can support yourself or someone else who uses substances. I'm Laura McKenzie, host and producer of Midcoast Morning. Jesse Woodward is our executive producer, and Aubrey Frew is our technical advisor. You can sign up for CHOI's newsletter at choi.ca/subscribe for updates from our news department and more. Our theme song is First One by local Nanaimo band Waste Management. You can find more of their music on their Bandcamp. Support local artists by buying their music. If you have a story you'd like us to cover, email us at news@choi.ca.
Midcoast Morning would not be possible without the funding of the Community Radio Fund of Canada's Radio Meters program and listeners like you. Midcoast Morning is a project of CHOI's nonprofit newsroom. Support nonprofit journalism in Nanaimo and on the Salish Sea today by becoming a monthly sustaining donor at $5 or more per month. Support the program at choi.ca/donate. If you're already a supporter, record a voice memo telling others where you're listening from and why they too should support our work. After you're done, you can email it to us. Also, share the podcast with your friends. While Meta is blocking Canadian users from sharing news content on their Facebook feeds, you can still share our podcast directly with your friends via Facebook or Instagram Messenger. Finally, this program acknowledges and gives thanks to the Snuneymuxw First Nation as we broadcast and podcast from their traditional territory. Thanks for listening.